Non-communicable diseases such as cardiovascular diseases, cancers, chronic respiratory disease, and diabetes account for almost 2/3 of all deaths in the WHO Southeast Asia region. Half of the NCD deaths are premature in the age group of 30 to 69 years, representing loss of productivity with impact on the economy of families and countries. Tobacco, harmful use of alcohol, unhealthy diet, and insufficient physical activity are among the major risk factors for NCDs. To combat this escalating public health challenge, NCDs were designated as a flagship priority by the Regional Director, Dr. Poonam Khetrapal Singh, in 2014, with the focus on addressing them with best buys, the most effective, evidence-based, feasible, affordable, and cost-effective interventions in any resource setting. Since then, the Best Buys approach has been steering the region's collective drive to achieve NCD targets for addressing risk factors and managing cardiovascular diseases, diabetes, cancer, and chronic respiratory illness. Mental health, impact of air pollution, and climate change were added to the issues for collective and urgent attention and action. The WHO Southeast Asia Regional Action Plan 2013-2020 offered multisectoral action plan with time-bound targets. Post-COVID-19 pandemic, the plan has been extended to 2030 to meet the Sustainable Development Goals for health with renewed commitment to accelerate most impactful interventions and scale up digital and other innovations. The commitment of countries, WHO and partners has reflected in the several governing body resolutions, decisions and declarations, matched with sustained investment, impressive legislative and regulatory measures for NCDs and action on the ground. As a result, despite being among the largest producers and consumers of tobacco, the region witnessed the fastest decline in tobacco use between 2000 and 2020, with smoking prevalence among men declining from 50% to 20%, and smoking prevalence among women declining from 8.9% to 1.6%. The region led in implementation of large-size pictorial warnings in India, Maldives, Nepal, Sri Lanka, and Timor-Leste. Bhutan, India, Indonesia, Nepal, Maldives, Sri Lanka, and Timor-Leste established and scaled up tobacco cessation. WHO launched Quit Tobacco app. India and Nepal are on track to meet 30% reduction in tobacco use among adults. To reduce harmful use of alcohol, countries launched media campaigns, changed alcohol import regulations, restricted availability of alcohol, increased taxes, and strengthened de-addiction services. Thailand outlawed sale of alcohol. Sri Lanka banned home delivery of alcohol. Nepal launched Safer Alcohol Control Initiative in 2022. To address unhealthy diets, obesity, and undernutrition, all countries took multiple measures. As a result, the decade witnessed substantial reduction in all forms of malnutrition, promotion of healthy environment, and its multifarious impacts. Bhutan, India, Maldives, Sri Lanka, Thailand, and Timor-Leste are on track to meet global target of no increase in overweight children under 5 by 2025. The number of stunted children in the region reduced from an estimated 41.6 million in 2010 to 30.1 million in 2020. Bhutan, DPR Korea, India, and Nepal are on track to achieve global nutrition target of 40% reduction in the number of stunted children by 2025 compared to 2014 baseline. 10 countries have met the global target of increasing breastfeeding in first 6 months by 50%. India, Maldives, Sri Lanka, and Thailand have adopted measures to tax sugary drinks, while Maldives and Sri Lanka have banned such drinks from schools. 6 countries have implemented at least one population-based intervention to reduce salt intake. Thailand became the first country in the region to issue a Trans Fat Act, followed by India and Bangladesh. Sri Lanka, Indonesia, Maldives, and Nepal are in the process of banning trans fat. To promote physical activity, DPR Korea, India, Indonesia, Maldives, Nepal and Thailand rolled out public awareness campaigns. Outdoor gyms were set up by Bhutan, India, Sri Lanka and Timor-Leste. Concerted efforts were made during the decade to raise awareness for long-term sustainable and multisectoral solutions to address air pollution by tackling the source of pollution and for action to mitigate health impact of climate change. Countries are mainstreaming NCD screening, diagnosing and treatment. 9 countries are now implementing the WHO PEN, which helps integrate NCD services at the primary level. Between 2010 and 2019, the region improved its NCD coverage sub-index from 57 to 61. Over the past 5 years, 10 million more people with hypertension have accessed protocol-based management, almost doubling the control rate from 26% to 47%. The region is also rolling out an innovative See Hearts initiative that brings together efforts to control tobacco, reduce salt consumption, eliminate trans fat and control the harmful use of alcohol, along with improved coverage of hypertension and diabetes control services through the primary healthcare approach. The region has collectively agreed on Dhaka Call to Action for accelerating the control of cardiovascular diseases and placing 100 million people with hypertension and/or diabetes on protocol-based management by 2015, using See Hearts strategies. 5 countries have announced their targets. India is aiming to reach 75 million people with hypertension and diabetes under standard care by 2025, in the largest expansion of NCDs in primary healthcare globally. Countries are implementing groundbreaking cancer prevention and care initiatives. The Southeast Asia Cancer Grid, called CCAN Grid, was formed as a platform to facilitate collaboration in cancer care in the region. Southeast Asia Childhood Cancer Network member institutes provided improved care to over 5,000 children with cancer in the region. On cervical cancer, the region is achieving rapid, life-saving progress. The WHO CRO launched NCD Dashboard as a platform to provide information on different aspects of NCDs in the region. Ever since NCD was designated as a flagship, the region is witnessing strong political commitment, will and leadership for multi-sectoral engagement and partnerships. Moving forward, a whole-of-government and a whole-of-society approach is essential to enhance our collective action on NCDs, with primary healthcare and universal healthcare as pillars of advancing health for billions.